Hi, my name is Sarah Blitz, and I'm going to be presenting our project titled Correlation of Lesion Persistence and Outcomes in MR-Guided Focused Ultrasound Thalamotomy for Essential Tremor. For a bit of background first, in patients with medication-resistant essential tremor, MR-guided focused ultrasound to ablate the VIM nucleus of the thalamus has been demonstrated to be a successful treatment for long-term tremor reduction. At our institution, we have seen that at the 24-hour postoperative MRIs, you can see the lesion in the thalamus in all patients. However, at the 3-month and 1-year postoperative appointment, you can only see the lesion in a subset of patients. So in this example, you can no longer see the lesion at that 3-month MRI. The goal of this study was to determine whether the presence or absence of the lesion was correlated with clinical outcomes. And in this patient, you can see that at the 3-month postoperative MRI, you can still see the lesion. And to do this, we completed a retrospective single surgeon series of patients who underwent MR-guided focused ultrasound for essential tremor. We analyzed the T2-weighted MR images for the presence of the lesion using a binary, yes, we can still see the lesion, or no, we no longer see that T2 bright signal in the treated area. We also compared the FTM score of tremor severity at the preoperative, 3-month, and 1-year appointments between the groups where there was a visible lesion to the groups where there was not a visible lesion. And finally, we compared the side effects, including motor deficits, paresthesias, dysarthria, fatigue, and imbalance. We found that visible lesions were present in all patients 1 day post the procedure, and residual chronic lesions were substantially smaller and detectable in only 53% of patients at 3 months and 47% of patients at 1 year. We also found that there was significant improvement in FTM scores at 3 months and 1 year in groups that did have a lesion present and those that did not. However, there was no significant difference in the scores or overall improvement between patients with a visible lesion and those without. There was also no significant difference in patients who experienced any side effect or in a specific type of side effect. And in conclusion, the lesions are visible on T2-weighted MRI in about half of patients at 3 months and 1 year post MR-guided focused ultrasound thalamotomy. And additionally, the presence or absence of the lesion in the long term was not correlated with tremor outcomes or side effects. In the future, we plan to investigate sonication parameters and their effect on lesion persistence, as well as clinical outcomes, potentially looking at any correlation with the skull density ratio, and looking at imaging imaging sequences such as DWI or SWI, which have been shown in other studies to show lesion persistence for longer. And that is all. Thank you.